We begin here. Acting Health Minister Mmamoloko Kubayi is visiting the Northern Cape to deal with vaccination challenges in the province. Access to rural parts of the province remain a challenge for people there in far-flung areas are still waiting for the vaccine to reach them. Now, let's get an update. We cross to our reporter, Ulrich Hendriks. Ulrich, thank you so much for your time this afternoon. Now, why exactly is the minister there, Ulrich, and what are some of the concerns that she has?
Well, good afternoon, Unati. Well, the minister arrived a couple of seconds ago here at the R District Hospital. Of course, she's looking at the way the Northern Cape is fighting the COVID-19 pandemic. Of course, we have seen that Northern Cape entered the third wave about a month or two before the rest of the country. And then we saw the numbers slightly going down in the last month or two. But in the last couple of weeks, and the minister even saying last week during a weekly briefing that she's very concerned about the Northern Cape, the rising numbers here with the Northern Cape. Coupled with that as well is that we have a very slow uptick in vaccinations. Of course, we're looking at teachers, not as many teachers as they wanted has been vaccinated, and also in the police force, a very slow process that is happening at the moment. So not the police and the essential workers not as fast as they would like it to happen. And then, of course, the other issue here in the Northern Cape, you remember, very vastly rural. So you have villages very 2-3 hours away from main centers where people are saying that they haven't received the vaccine yet, they don't know where to fetch it, and even if they have to go to main cities, it is a very expensive exercise for them to get there because it takes 2 to 3 hours just to get there, plus the associated transport cost. Unati?
Ulrich, let's talk about those numbers. Now, you'll recall when the country went into the third wave, it was fairly different from the first and the second wave in that your smaller provinces or with a smaller population like the Eastern Cape and the Northern Cape, you know, they started edging into the third wave much quicker than your Gautengs and your Western Cape. Talk to me about what the numbers are and how hospitals have been treating people during this time. Are they higher in this third wave? Have you reached the peak as the Northern Cape?
Well, it's quite an odd situation, Unati. Like I said, we entered the third wave much sooner than the other provinces. So we had very high numbers, and then obviously a lot of hospitalizations as well in all the districts here within the Northern Cape. Of course, of concern is this Pixley Kasemi area where we are in the R, and then of course the Francis Bars district, that's your Kimberley area. So you had a very high number of people being admitted for COVID pneumonia and a number of deaths as well. And we actually, during that stage, we had, for this province at least, that was record highs of 610, 614, close to 700 people being diagnosed with COVID-19 per day. And of course, the high death rate as well. Then we, as we reached the peak, we went down to sometimes just over 100 of positive cases per day, and now we're seeing a sharp increase again. The other day we had again 359 COVID positive cases again, and that is the concern here for the Health Minister and of course the MEC of this province as well. But also they want to because in the past they were saying that they were waiting for the Johnson & Johnson vaccine to roll it out because of this is a very rural province, and they do and the outlying areas do not necessarily have that cold storage needed for the Pfizer vaccine. So now with the Johnson & Johnson having arrived and then being distributed to places, especially the Northern Cape, they're hoping that they can increase the vaccine rollout to those places, the outlying areas, the very rural areas within this province. Unati?
Ulrich, it's very interesting that you mention the similarities in terms of the concern from government's point of view where it relates to DR and Kimberley. Now, we know that those two towns are very different, with Kimberley being the economic hub, if I can call it that, of the Northern Cape. Speak to me about vaccine hesitancy in the province, as it were. I mean, I'm told also that there could be some slight similarities between vaccine hesitancy and what some people have called COVID-19 denialism, in that, you know, those that deny that COVID-19 it doesn't exist even today are quite hesitant to vaccinate. I mean, we told that funerals, as an example, in Kimberley are held pre-COVID times. There is no COVID-19 as far as funerals are concerned in that province. Speak to me about those two issues.
Well, Unati, we have seen, and there's quite a number of concerns about the way that funerals are being handled here in the province. Of course, you see quite a number of people attending the funeral in the first instance, so more than the 50 allowed by the current level 3, adjusted level 3 regulations. So that is a concern in itself, but also what happens before and what happens after those funerals. So you have the aftertier still. You still have people before that going to the houses of the deceased, and then doing the prayer sessions in the days leading up to the funeral. And so the Northern Cape Health Department have been really trying to get the message across to people to say that these lockdown level 3 regulations are there to protect everybody, and that people should use masks as well. But we have seen some hesitancy in terms of taking the COVID-19 vaccine, whether it's Johnson & Johnson, Pfizer, or any of the others. We see that a lot of people on social media, for example, are actually openly saying that I'm not going to take the vaccine, so people still need to be convinced that it's safe, that COVID does exist, that people are actually dying of COVID, and that it's safe to take the vaccine, not only for yourself but also for other people as well. Unati.
Ulrich, thank you so much for your time. That's Ulrich Hendriks, they are reporter filing from us from DR in the Northern Cape. Quite concerning. Now, he's obviously just talking us through the fact that the Health Minister, the acting Health Minister, Mmamoloko Kubayi, is visiting the Northern Cape to deal with vaccine challenges in that province. Now, as you've heard from Ulrich there, that there is vaccine hesitancy, but that also probably stems from the fact that people in the Northern Cape, in some parts of the Northern Cape, still believe that COVID-19 doesn't really exist, having funerals in large numbers still, and not adhering to some of those regulations. Quite disturbing reports coming from that province.